Thanks for inviting us in tonight. Pfizer could now be paving the way for the next round of COVID vaccinations, this time for Americans age 5 through 11. Now, we know this is probably going to impact lots of Indiana families, so let's get right to it. Our big story tonight looks into how this approval process for the COVID vaccine works and how some Indiana parents feel about it. But first tonight, we're hearing from pediatricians who say they're hopeful about this next phase of the vaccine rollout.
The newly released data from Pfizer comes as schools are in full swing and pediatric cases are soaring.
As a pediatrician and a parent myself, we've been eagerly awaiting news about a vaccine for our younger kiddos.
Dr. Suzanne Grannon is the pediatric medical director for Community Health Network. She says a vaccine for younger age groups could give doctors another tool to fight this virus and its contagious variants. Right now, data shows pediatric COVID cases have jumped 240% since July.
With the start of school, it was pretty chaotic, and the best advice I could offer to parents was, get your vaccine for yourselves, because that surrounds your kids with vaccinated adults, and have them wear masks indoors.
But now kids could have another form of protection. So let's take a look at this trial. To start, the FDA asked for 6 months of follow-up safety data instead of the 2 months it asked for with adults. It also asked Pfizer to double the number of kids in its trials between the ages of 5 and 11. And keep in mind, this isn't the same dose that adults get. The trial uses 10 micrograms instead of 30.
And what they were trying to determine was the optimal amount to have the same immune response with a minimal amount of side effects.
The hope is to have this vaccine ready for kids by Halloween. Dr. Grannon says some parents are eager while others plan to wait. Either way, she says families should talk to their doctor if they have concerns or questions.
In order for a vaccine to get a green light, there are steps that a company has to go through. They put their vaccines through multiple phases of trials to gather data to share with federal regulators. After getting emergency use authorization, those studies then expand to include real-world data. An FDA committee reviews information for the agency to approve, and another independent group reviews the safety and efficacy information so the CDC can issue its guidance. Once it goes through both the FDA and CDC, then it can be given to the public.